Unfortunately, we weren't really able to get to an end point on who is able to, who the former president should be able to pick. But I'm hoping that the conversation so far guides you in a sort of way to help you gauge who the former president should be able to pick. All right, then, let's move to other issues. And the increase in the number of cases of COVID-19 in Ghana has prompted calls for behavioral change, communication to be intensified to compel the public to adhere to enshrined protocols to curb spread. Joining us on Zoom is Professor Yosin, a public health expert, and Dr. Letitia Adelaide Appiah, Executive Director, National Population Council. Good morning. Good morning. Right. Unfortunately, we are not exactly ready. Now, the World Health Organization, though, has said that Ghana is one of the countries that is that is driving the increase in COVID-19 cases in Africa. This is in a backdrop of the WHO saying that 190,000 people will die from COVID-19, and between 29 and 44 million people will be infected. Listen to Dr. Mary Stephen, who is Technical Director for the WHO regional office in Senegal.
The number of cases you see when you test depends on the kind of transmission pattern you have. So really, if you have community transmission, you will pick quite a number of cases when you test. And even if you do not test, for instance, we said earlier 20%, 15% will present with severe disease and 5% with critical illness. So you have 20%, which is quite a number of cases, especially in big countries. So they will present in the hospitals at the end of the day, or it will present as community death, which will be picked. So, but if you have a country that is reporting sporadic cases or cluster of cases, no matter how much you test, you will still not pick so many cases. So it actually depends on the kind of transmission you have in country.
What you're saying is that argument is moot.
So like I said, yes, it depends on the transmission. The number of cases you pick, it depends on the transmission pattern. So if you have community cases, you will pick more cases. Community transmission, you will pick more cases, definitely.
Right, it's so live on JoyNews desk with me, Daniel Dazi. Let's go on Zoom. Professor Yosin is a public health expert, and Dr. Letitia Adelaide Appiah, Executive Director, National Population Council. Now, Dr. Letitia Adelaide Appiah, you are the head of the National Population Council. Could Ghana's population, somewhere around 31 million, and the density of our urban areas be a cause for the high number of COVID-19 cases we're seeing in recent times? Right, Dr. Appiah, can you hear me?
Well, thank you so much for your... Yeah, I can hear you intermittently, unfortunately, but I can hear you. Can you hear me?
You're live on air. Please go ahead.
Can you hear me? Oh, yeah, thank you so much for the opportunity. Yes, population dynamics and density are very important in this pandemic. As we already know, looking at the spread, we have a greater in Kumasi being the most densely populated areas. And so it's not surprising that we have most cases from there, because the stay of COVID is social distancing, hand washing. But then with high population density, it's difficult to obey those protocols. So it means we really have to do a lot more in Greater Accra and Kumasi, focusing a lot more on the mask, making sure that in open spaces, in crowded spaces, we mask up and obey the protocols. If you look at regions where the population density
it seems we have a bit of a challenge with Dr. Appiah's Zoom connection. We are finding it difficult to hear her. So we would go to Professor Yosin, who is a public health expert. I think we caught the summary of what Dr. Appiah was saying, which was that because Accra and Kumasi are densely populated, it's no surprise that these two places are hotspots. Would you agree with that line of thought, Professor Yosin?
Exactly, that's what Letitia has said. Yes, it's true. The transmission pattern of the COVID-19 is now quite well understood, and we know any event that bring a lot of people together, or events that bring a lot of people together, mass gathering, has the potential to increase transmission.
Right.
And unfortunately, we are having a lot of events occurring almost simultaneously in the country, and that is really where our challenge now is. Events that bring a lot of people together in closed areas and spaces.
Events like the voter registration exercise?
Certainly. If we as individual adult Ghanaians cannot adhere to simple protocols, that is very challenging. And in fact, it's challenging for everybody, because we should protect ourselves and protect others. And if we just cannot obey those simple social distancing rules, we cannot wear our masks, and we cannot be patient and be in line and go and do the registration, it really leaves much to be desired, and it's very difficult to understand and to manage, knowing very well the pandemic situation we are dealing with.
Now, Dr. Appiah, would you then say that because the population distribution is part of the problem, one of the lessons we can pick going forward will be implementing measures to control the growth of our population?
Well, population dynamics is everything, because even how we respond to the pandemic, it really is influenced by population dynamics. If you have young people who are poor and are living on the streets, for instance, then implementing your protocols. The protocols are universal, but then you adapt it to your situation based on your peculiar dynamics. And so if we have, for instance, so many poor people who cannot feed, who cannot have water to wash their hands, who cannot have safe living places, then we really have to rethink the quality of life that a Ghanaian should have. And if a Ghanaian's quality of life should have, then we should be thinking about the quality and the numbers in sync, so that in case there's another pandemic, that we all have to run home, we would have safe homes where there's water, where there's toilet facilities, where we can feed and stay for at least for 2 weeks without having to go out.
And how do we manage
really
these dynamics? How do we manage these dynamics? What are the top 3 measures that we should apply?
Well, the top 3 measures we should apply is planning our families, because without planning, you can't do anything.
Okay.
If you cannot plan your cities if you are not planning the families, because the family is the unit of society. And
so that's
if
one.
We plan
Family planning is one.
And say that the Ghanaian in the 21st century, in the knowledge era, should be a highly skillful, educated Ghanaian, then we have to look at the number that we can comfortably, skillfully educate, well-nourished, and well-catered for development.
So family planning is one. And
so that should be the basis. If you cannot plan the family, I don't see how you can plan the nation.
Right,
because the family is made up of, the nation is made up of family.
I asked for 3. Family planning is one end, or is it just family planning?
Yes.
Right. Okay. Yeah. Let me take that thought to Professor Yosin. Professor Yosin, so you agree that the long-term solution to controlling population growth so that we can manage our resources well is family planning?
Yes, as Dr. Letitia said, it's key. Family planning is key. And also another key activity is education, and especially educating the girl child. If we as a nation can keep the girl child in school for longer, going forward, that is one massive investment that will yield a lot of dividend for the future population. If you keep the young girl in school for longer, she will delay the time she will start giving birth, and also delay the number she can possibly give birth to, because she will start late and will not have the luxury. But if she gives birth at 18, by the time she is 36, she is a grandmother because the child she gave birth to at 18 has also started giving birth.
Right.
But if you keep her in school for longer, then this will be what we call a demographic dividend and a social dividend for the country going forward as well. So keeping the girl child, educating both boy and girl child, but keeping the girl child in school for longer than we are doing now is also a key factor.
I'm very grateful, Professor Yosin and Dr. Letitia Adley, for joining us this morning. It's the Live on News Desk now.